Hello everyone. My name is Kim Boone. Today, the topic for our seminar is cardiovascular disease. Cardiovascular disease is caused by disorders of the heart and blood vessels, and includes coronary heart disease like heart attacks, cerebrovascular disease which is known as stroke, raised blood pressure which is hypertension, peripheral artery disease, rheumatic heart disease, congenital heart disease and heart failure. Cardiovascular diseases may include coronary heart disease which is a disease of the blood vessels supplying the heart muscle, cerebrovascular disease, a disease of the blood vessels supplying the brain, peripheral arterial disease, a disease of blood vessels supplying the arms and legs, rheumatic heart disease which causes damage to the heart muscle and heart valves from rheumatic fever caused by streptococcal bacteria, congenital heart disease which is the malformations of heart structure existing at birth, and deep vein thrombosis and pulmonary embolism as the blood clots in the leg veins, which can dislodge and move to the heart and lungs. Heart attacks and strokes are usually acute events and are mainly caused by a blockage that prevents blood from flowing to the heart or brain. The most common reason for this is a build-up of fatty deposits on the inner walls of the blood vessels that supply the heart or brain. Strokes can also be caused by bleeding from a blood vessel in the brain or from blood clots. The cause of heart attacks and strokes are usually the presence of a combination of risk factors, such as tobacco use, unhealthy diet and obesity, physical inactivity and harmful use of alcohol, hypertension, diabetes and hyperlipidemia. At least 3/4 of the world's deaths from CVD occur in low and middle-income countries. People in low and middle-income countries often do not have the benefit of integrated primary health care programs for early detection and treatment of people with risk factors compared to people in high-income countries. People in low and middle-income countries who suffer from CVD and other non-communicable diseases have less access to effective and equitable health care services which respond to their needs. As a result, many people in low and middle-income countries are detected late in the course of the disease and die younger from CVD and other non-communicable diseases, often in their most productive years. The poorest people in low and middle-income countries are affected most. At the household level, sufficient evidence is emerging to prove that CVD and other non-communicable diseases contribute to poverty due to catastrophic health spending and high out-of-pocket expenditure. At macroeconomic level, CVD place a heavy burden on the economies of low and middle-income countries. Several health conditions, lifestyle, and age and family history can increase the risk for heart disease. These are called risk factors. Most of the people have at least one of the 3 key risk factors for heart disease: high blood pressure, high cholesterol, and smoking. Some of the risk factors for heart disease cannot be controlled, such as age or family history. High blood pressure is a major risk factor for heart disease. It is a medical condition that occurs when the pressure of the blood in your arteries and other blood vessels is too high. The high pressure, if not controlled, can affect your heart and other major organs of your body, including your kidneys and brain. High blood pressure is often called a silent killer because many people do not notice symptoms to signal high blood pressure. Lowering blood pressure by changes in lifestyle or by medication can reduce your risk for heart disease and heart attack. The cholesterol is a waxy, fat-like substance made by the liver or found in certain foods. Your liver makes enough for your body's needs, but we often get more cholesterol from the foods we eat. If we take in more cholesterol than the body can use, the extra cholesterol can build up in the walls of the arteries, including those of the heart. This leads to narrowing of the arteries and can decrease the blood flow to the heart, brain, kidneys, and other parts of the body. Some cholesterol is good, and some is bad. High cholesterol is the term used for high levels of low-density lipoprotein, or LDL, which are considered bad because they can lead to heart disease. A high level of high-density lipoprotein cholesterol, or HDL, is considered good because it provides some protection against heart disease. A blood test can detect the amount of cholesterol and triglycerides, a related kind of fat, in your blood. Diabetes mellitus also increases the risk for heart disease. Your body needs glucose, which is sugar, for energy. Insulin is a hormone made in the pancreas that helps move glucose from the food you eat to your body's cells. If you have diabetes, your body doesn't make enough insulin, can't use its own insulin as well as it should, or both. Diabetes causes sugars to build up in the blood. The risk of death from heart disease for adults with diabetes is 2 to 4 times higher than adults who do not have diabetes. Diets high in saturated fats, trans fat, and cholesterol have been linked to heart disease and related conditions, such as atherosclerosis. Also, too much salt or sodium in the diet can raise blood pressure levels. Besides that, not getting enough physical activity can lead to heart disease. It also can increase the chances of having other medical conditions that are risk factors, including obesity, high blood pressure, high cholesterol, and diabetes. Regular physical activity can lower your risk for heart disease. Obesity is linked to higher bad cholesterol and triglyceride levels and to lower good cholesterol levels. In addition to heart disease, obesity can also lead to high blood pressure and diabetes. Moreover, drinking too much alcohol can raise blood pressure levels and the risk for heart disease. It also increases levels of triglycerides, a form of cholesterol, which can harden your arteries. Tobacco uses can increase the risk for heart disease and heart attack. Cigarette smoking can damage the heart and blood vessels, which increases your risk for heart conditions such as atherosclerosis and heart attack. Also, nicotine raises blood pressure, and carbon monoxide reduces the amount of oxygen that your blood can carry. Exposure to other people's second-hand smoke can increase the risk for heart disease even for non-smokers. Family members share genes, behaviors, lifestyles, and environments that can influence their health and their risk for disease. Heart disease can run in a family, and your risk for heart disease can increase based on your age, and your race, or ethnicity. When members of a family pass traits from one generation to another through genes, that process is called heredity. Genetic factors likely play some role in high blood pressure, heart disease, and other related conditions. However, it is also likely that people with a family history of heart disease share common environments and other potential factors that increase their risk. The risk for heart disease can increase even more when heredity combines with unhealthy lifestyle choices, such as smoking cigarettes and eating an unhealthy diet. There are other characteristics present as well. Both men and women can have heart disease. Some other characteristics that you cannot control, like your age, sex and race or ethnicity, can affect your risk for heart disease. This figure shows about the declared normal levels that doctor will use to tell you whether your various serum or blood levels are normal. This is my references. That is all for my presentation. Thank you.
Yeah, so that's all for my presentation about the cardiovascular diseases. Do you all have any questions?
Yeah, I have a question. What are the examples of cardiovascular diseases that are normally found?
Normally, it will include coronary heart disease, cerebral vascular disease, and also congenital heart disease.
I see. Thank you.
What are the risk factors which related to cardiovascular disease?
Majorly, it includes three factors. One is the condition that increase the heart risk for heart disease, and then second one will be the heart disease behavior, and also the family history will influence as well.
For other conditions that can increase the risk of getting heart disease?
The main conditions will be the high blood pressures and also the cholesterol.
Okay, may I ask how the tobacco link with the heart disease behavior?
Especially the nicotine, it can raise the blood pressure in our bodies, and also the carbon monoxide can also reduce the amount of the oxygen that our body can actually carry.
Yeah, exactly. How does family history causes the heart disease?
So when the family pass the traits from our generation to another generations, means the genes that possess is called the heredity, and the genetic factors will likely to play the role in high blood pressures and also heart disease and other related conditions as well.
Alright, thank you.